Hello everyone, welcome back to the next video in the series on what tests should a person with diabetes do. Today I am going to talk about some very common tests and I'll try to explain to you why even these tests are very important. For example, all of you would have heard of a test called hemogram. Now hemogram is to check the blood parameters in your body. Now why should we do such a simple test for a person with diabetes? Oh, it gives us so much of information, I cannot tell you. For example, if you take a hemogram, there are three things that we look at the hemogram. First is the white blood cells, the second is the red blood cells and your hemoglobin, and the third is your platelet count. Now, the white blood cells has a certain normal, let's say it's between 3000 and say 5000 or 6000 will be normal. Now you come for a routine checkup and we find that your white cell total count is say 12,000. It means that you have got some infection somewhere in the body, and we'll immediately try to find out where the infection is. Is it a dental infection? Is it a urinary infection? Is it a gallbladder infection? Is it a liver infection? Is it some other infection? We'll immediately be able to find it out, give you the proper treatment, and then we can settle it. You will not believe if I tell you that just by doing routine hemogram of patients who just walked into our center just for a routine diabetic checkup and they have not told us any symptoms, we have been able to pick up even leukemia. Every year we pick up at least 5 or 6 cases of leukemia just by doing this. And very often we pick it up in the early cases, in the very early stage, and we've been able to cure many forms of leukemia. As you know now, or blood cancer are actually treatable, completely treatable and curable. So that's one of the advantages. Some other disease you have also we can pick it up. When you look at the breakdown of the white blood cells, we look at the neutrophils and lymphocytes, that will tell us. For example, in COVID, there is a certain pattern that we can pick up. By actually studying some of this neutrophil to lymphocyte ratio, we can even predict who will develop diabetic eye disease and kidney disease. This is something which we have proven. Now let's come to the hemoglobin level. Now the normal hemoglobin for men should be 13 grams and above, 13 grams, 14 grams. For Indian women, 11 or 12 grams can also be normal. But suppose we find that your hemoglobin is only 9 grams or 8 grams. That means you have anemia. Now why do you have anemia? Is it due to an ordinary iron deficiency anemia that you have? Is it some other B12 deficiency that you have? Or are you bleeding somewhere and that's the reason why it went down? This can be life-saving. Very often, because the anemia develops slowly, you may not even be aware of it until we do the test, and again this can be life-saving. The third one I mentioned is the platelet count. Now the platelet count going down low is a sign of certain disease. For example, you have dengue, the platelet count goes down, and there are certain other conditions. For example, if your spleen is overworking, hypersplenism we call it, then your platelet count goes down and then you are at risk of having an internal bleeding. All these can be picked up just by doing a hemogram. So the next time, please see that every year, at least once, your hemogram is tested. So stay safe, take care of yourself, and I wish all of you a long and healthy life despite diabetes. Thank you.